COVID-19 changed the way we live. It forced us to turn online for literally every single thing, from entertainment to studies to even healthcare and healthcare apps. With the advancement of technology, we've entered a digital era and become more and more attached to our smart devices. Smartphones have now become such an integral part of our lives that we sometimes end up depending on them more than we should be, maybe more than even other human beings. It helps us organize our day, schedule our appointments, and be connected to other people. And now with the innovation in healthcare and the rise of mobile applications, there's a gradual growth in mHealth or healthcare apps. Numerous apps are now available to assist healthcare professionals in providing timely diagnosis to patients, patient management, and monitoring, among many other benefits. And smartphone apps have provided many benefits to healthcare professionals also. The most important one being increased access to point-of-care tools. And one such healthcare app is Swasa, a software-based Class 2 medical device that is a screening tool for respiratory diseases. Now, this tool is as simple as a cuff into a phone. The person does not need to go to a public healthcare center or other medical facilities. A connected device is all that is needed. Swasa can be thought of as a point-of-care SAMD software for instant evaluation of respiratory health. It's similar to home monitoring for blood glucose and blood pressure for respiratory health. We met Manmohan Jain, CEO, Syria Technologies, to tell us more about how this AI-based app works.
Doctors are harnessing the power of mobile phones and apps to improve healthcare services. The demand for digital healthcare, both telemedicine and healthcare-related software applications, saw a big boost during the COVID-19 pandemic. Smartphones and apps provide numerous benefits to healthcare professionals. Increased access to point-of-care tools has helped in decision-making and improved patient outcomes. Imagine you cough into your smartphone and that helps you identify the quality of your lungs within a few seconds. Hyderabad-based company Syria Technologies developed an award-winning AI-based app Swasa that helps do that. Like other home devices these days to monitor blood pressure and blood glucose, Swasa is a software-based Class 2 medical device or SAMD, as they are called, for instant evaluation of respiratory health.
The Swasa is a device that can analyze your cough sounds, and by doing an audiometric analysis of the sound, within a few seconds, you can get a quick read of your lung health.
Respiratory health is often overlooked by patients because of the cost involved in the battery of tests that they have to get done.
The traditional tests that have been used for respiratory health are they involve expensive equipment. You have like a CT scan or a spirometer or even X-ray. And to do that, you need to have an appointment, you need to have like a hospital or a clinic, and a trained technician.
Swasa was primarily used to diagnose patients with COVID-19. It has now obtained the clinical validation to check for TB as well. Work is in progress to get the clinical validation for ailments like asthma and bronchitis, among others.
Based on data and clinical validations that we are doing, is one by one we want to identify the likely presence of disease and which disease is it. So the Swasa can also provide likely indicator of pulmonary TB, COVID, and there's a clinical study going on right now in CMC Vellore, where an additional 5 diseases will be able to identify, like asthma, bronchitis, pneumonia, interstitial lung disease.
So how does the AI-based app work?
Doctor or a healthcare worker, frontline healthcare worker, registers a patient, asks the patient to cough into the phone for a few seconds, and then instantly the result comes. A detailed report is available to the doctor.
Dr. Harshal Ramesh Salve, faculty member, Center for Community Medicine, AIMS, uses the app and finds it extremely useful.
It is an application, so it's a mobile in terms of its logistical issues, and it is very user friendly in terms. It's a cuff sound based AI system which is a built-in the Swasa app. So that helps patient That reduces the time in terms of identification.
How does a doctor use the app?
App use the cough sounds. That is the first thing. On the basis of that, they takes that one input. Second input, you also have to include the information related to the symptoms patient is having. Then some vital registrations in terms of blood pressure, your pulse pressure, your other fever and other related vital information feeds into the application. And we also need to fit in the demographics, the gender, the age, height, weight, BMI. So using all this information and using AI technology, the app by using cuff sounds, it gives the sort of presumptive diagnosis with respect to the restrictive or obstructive lung disease or the normalcy of the lung function.
So it's actually as simple as it sounds. You download the Swasa app on your phone and register and simply cough into your phone for 10 seconds. Okay, so within about 10 seconds, it'll give you an assessment of your lung health. Between 1 and 10, the lower the score, the better your lung health. Okay, I get an index of about 4, which is a normal and healthy lung.
The smartphone and processor plays a very important role in recording the cough sounds and analyzing the data. But how does it collate and scan the data? The team says Swasa is backed by the science born out of 7 clinical validations and international journal publications. Over 3 lakh assessments have been done on the platform, and the role of the processor is critical to get results accurately and efficiently.
Swasa primarily works on audiometric analysis of the sound, the cough file. So it is getting a high quality recording of the audio is very important, and the right technology in the mobile is important for that. A good processor that can ensure a good quality recording in real time, and a recording that wherein we can extract the relevant information. Swasa captures the cough file and then extracts various events and multiple data points in that audio file, and to that it applies a proprietary AI ML algorithm to get the result. Further, the process having good input output and memory handling is important to be able to transmit the file to cloud in real time.
With the advent of 5G, the processor becomes even more relevant when we consider 5G enhancements to digital health, which will include real-time remote monitoring and instantaneous video consultations. With 5G, the audio of the person coughing can be recorded, and there can be even real-time consultation with a pulmonary specialist if the screening shows high risk. Swasa was recently awarded the 12th Anjani Mashelkar Inclusive Innovation Award for developing the low-cost solution. The software has obtained patents from India and has applied for patents in other countries. The future of mHealth and healthcare apps is an area with immense potential. They can help get diagnosis faster and treat patients in a timely manner, reducing the burden on the healthcare workers. With camera person Nagraju, Uma Sudhir for NDTV.
Manmohan, I have to say, who would have thought that now you can diagnose patients with the help of an app? Welcome to the show, Manmohan, and congratulations on some incredible innovation. What is the technology behind analyzing the cough, and how does the processor come into play?
So the way Swasa works, as I said, it's an audiometric analysis of the cough sound. So we look at the cough sound, we extract various events from the sound and multiple data points in the cough audio file based on time, the frequency domain, all those things, to be able to identify a unique signature of the cough that we capture. And in doing all this, of course, the processing power and the quality of the processor and the capabilities it provides are all very, very relevant. So there's 2 aspects of this. First of all, it starts with recording a quality audio record of your cough file. So in that case, it is important to have good technology in the smartphone you're using so that we can record in real time high quality audio. So it is not just sufficient to have good quality microphones attached. The processor also needs to provide performance when we are using libraries like Media Recorder. Further, having good efficient IO handling, and multi-core technology that allows for multitasking with low latency. All of this enables us to upload the COF file to the cloud in real time.
Wow, Manmohan, once again, absolutely fantastic. I'm so impressed with what you've done. Cannot believe what else you'll be able to do with it as you refine this concept. Now, Snapdragon is calling all you Cell Guru fans to join their global community called Snapdragon Insiders. This gives you access to the latest scoop on Snapdragon tech, a chance to connect with the experts behind the scenes, premium experiences, exclusive contests, and so much more. I've been a Snapdragon Insider for a very long time. You can become one too by simply following them on snapdragon.in on Twitter or on Instagram. And also give yourself a chance to win a OnePlus smartphone by participating in the NDTV Snapdragon contest at ndtv.com. Unleash your dreams.